Conjunctivitis is a common condition whereby the thin transparent skin across the front of the eye becomes inflamed. The symptoms of conjunctivitis are your eyes will feel gritty, your eyes will look red, and there will normally be a discharge, which could be a watery discharge, or it can sometimes be quite sticky. There are a number of possible causes of conjunctivitis. It can be caused by infection, or it can be caused by an allergy. If the conjunctivitis is being caused by an infection, this could be infection by bacteria or infection by a virus. Viral conjunctivitis often occurs after you've been suffering from a cold or a sore throat. With the viral form, the discharge does tend to be watery rather than sticky. The viral conjunctivitis will resolve itself after a couple of weeks. Obviously, antibiotic eye drops are not going to help this condition. If your eyes are particularly uncomfortable, you may want to consider using ocular lubricants, or you could use painkillers. The bacterial form of the condition is similar but different in that the discharge tends to be a little bit more yellowish and more sticky. You may find your eyelids are stuck together when you wake up in the morning. This usually goes away after a week or so, but if you get some antibiotic drops from your doctor or your pharmacist, it can sometimes go away a little bit more quickly. It's very important with these infectious types of conjunctivitis that you maintain very scrupulous hygiene. These are very contagious conditions. You have to be careful about sharing towels and flannels, and you should do your best to make sure that any discharge on your lashes is removed using a cotton wool bud. The allergic form of conjunctivitis is different in that the main symptom patients complain of is itching. It also produces a discharge which tends to be watery, and we do see this more in the summer when patients with hayfever are exposed to pollen. If you feel you may be suffering from allergic conjunctivitis, you could speak to your GP or your pharmacist, and they may recommend that you use some antihistamines or antihistamine eye drops. If you suffer from any of the above signs or symptoms, it would be wise to have your eyes examined by an optometrist. They should be able to tell you what sort of conjunctivitis you're suffering from and advise you on the best course of action.